Thinking about breast augmentation? Wondering whether you are the right candidate for breast augmentation? So let's break down everything you know about breast augmentation. Hi, I'm Dr. Sachin, and today we are going to discuss in detail about breast augmentation. And let's hope all your queries will be solved and you will be able to take a right decision to go for breast augmentation. So, what is breast augmentation? Breast augmentation is basically augmentation for increasing the volume of your breast, either with the help of silicone implants or with the help of fat harvested from your own body. These are used to increase the volume of the breast, to lift the breast, to increase the projection of nipples, and in turn boost the confidence of the woman. Who should go for breast augmentation? So mainly there are three people who need breast augmentation. One, those in whom there is smaller size breast since birth. We call it involutional hypoplasia of breast. That is, since birth, some girls are having small volume of breast. They feel depressed. They don't feel confident about their breast. These are the girls who should undergo breast augmentation. Secondly, post-pregnancy or post-breastfeeding, there is sagging or loosening of breast tissue. There is decrease in the content of the fat and the breast gets sagged. So these patients, when undergo breast augmentation, there is volume increase and there is lift in the breast, and it gives a full volume rounded breast tissue. Thirdly, patients undergoing breast excision because of cancer surgeries or some traumatic cases, they have scarred breast tissues and they have decrease in their volume of breast. These patients, when they go for breast augmentation, there is return of the fuller volume of breast and also return of the confidence. Preparation for breast augmentation. How do you prepare a patient for breast augmentation? Firstly and foremost, we need to counsel the patient about the safety and about the routineness of the case. Patients have a lot of doubts in their minds whether there are any issues, whether there are any complications, side effects, am I the right person, will it be forever, do I have to do it again and again? These kind of questions are there in patient's mind. So let's talk about the myths or misconceptions about breast augmentation. So the most commonly asked question is, are the breast implants safe? Yes, they are very safe. Nowadays what we are using is the 6th generation silicone breast implant. These are made to fit properly on the chest of the female. They are rounded or anatomical shape. They are made up of silicone, which is very soft and gentle to touch, and when they are placed inside the breast tissue, it is very difficult to make out if there is breast implants inside or a normal fat. Secondly, they have got a very tough hardened shell, which is very tough and we cannot cut or puncture it. So these make the breast implant safe. There will not be any implant rupture or silicone gel rupture or disruption. So practically they are very safe. We have not encountered any kind of issue in these patients undergoing breast augmentation. Even few patients who underwent surgeries, some patients unfortunately had trauma to chest. Even in these cases, we studied them postoperatively with the help of ultrasounds and MRI scans, and there was no injury to the breast implant. There was no change in the consistency of the silicone of the breast implants. Some patients have a doubt that if they put implants inside, will they be able to feed their baby if they get pregnant? Yes, it's absolutely possible to breastfeed the baby. There is no change in the nipple sensation or a production of the milk. When we place the breast implants, we implant those silicone inside your breast tissue, underneath the breast tissue, or even underneath the muscles underlying the breast tissue. So practically the silicone implant has no direct communication or interaction with your breast tissue. The breast tissue responsible for milk production is quite away from the silicone implant, and our body, when we place implants inside, our body forms a shell or a core around this implant and doesn't let this breast tissue interfere with the silicone implants, and vice versa. So yes, after undergoing breast augmentation, we can undergo breastfeeding There is no change in nipple sensation, there is no risk of cancer, there is no risk of silicone rupture or implant rupture. So yes, it's a quite safe surgery done properly. It will not lead to any kind of complications. We have our patients done 15 years back. We still meet them, we still see the same amount of volume, the same breast shape, and yes, quite a few patients have undergone pregnancy, feeding, and they had no issues at all. So breast augmentation is a 100% safe surgery. So how do we perform breast augmentation? So generally there are two or three approaches towards breast augmentation. One is to cut around your nipple, secondly to cut underneath the breast tissue, and thirdly through the axilla. Most commonly we do these surgeries through a inframammary fold, that is a fold formed by breast tissue. The fold is inside, we have a small cut and the scar is practically invisible. So through a small 4 to 5 centimeter cut, we approach the breast tissue from inside. The breast tissue has a muscle underneath it. Under the muscle, a pocket is created and the implant is placed inside. So there is this breast implant, above it a muscle layer, and above it a breast tissue. So the muscle helps keep the breast implant in place, doesn't let it move around or slide or change its position. There are various kinds of breast implants. There are two types of breast implants. One is round and one is anatomical. Depending upon the patient choice, her desires, her expectation of the final volume and shape of the breast, we choose those implants and use them. This case is done under general anesthesia, lasts around 2.5 hours. It's a daycare procedure. We admit the patient in the morning and by evening the patient can go home. We advise the patient to rest for 2 days. After third day, the patient can start all the routine activities. By the end of a week, the dressings are gone, stitches are healed, and the patient is good to go. So a 1 week procedure and we can gain the breast volume and shape of our desire.